Inguinal Hernia Repair 49491-49525. Surgeons can repair inguinal hernias, otherwise known as groin hernias, by open, laparoscopic, or robotic methods, as well. Open surgery is performed under local anesthesia, while laparoscopic surgery is performed under general anesthesia, according to the Cleveland Clinic. In an open procedure, the surgeon makes an incision in the groin and cuts through the fascia to reach the inguinal canal. The surgeon dissects the inguinal canal to reveal the herniated sac. He or she inspects the herniated sac for defects. If there is no strangulation or necrosis, the surgeon can gently push the herniated tissue back through the inguinal canal into the abdominal cavity. In instances of strangulation and gangrene, the surgeon may remove the sac. The surgeon then sews the inguinal canal closed, often with absorbable sutures. He or she may reinforce the area with mesh or an implant. He or she closes the incisions in layers with stitches, staples, or surgical glue, and applies a medical dressing. In laparoscopic hernia repair, entrance is gained through small incisions. The surgeon introduces a laparoscope through one of the incisions and fills the area with carbon dioxide to increase visibility and maneuverability. The robotic approach is similar to the laparoscopic repair, except that the surgeon uses a robotic-assisted laparoscopic system and instruments to perform the operation, according to the Society of American Gastrointestinal and Endoscopic Surgeons. CPT coding and documentation. Codes for inguinal hernia repair are in Captain Code Range 49491-49525, which are in the section of 49491-49659, hernioplasty, herniorrhaphy, herniotomy. Because inguinal hernias can occur congenitally or by acquired means, coders may need to search documentation for the patient's age. For many of the Captain inguinal repair codes, the age is marked as post-conception age. According to Captain guidelines, this equates to gestational age at birth plus age of infant in weeks at the time of the hernia repair. The guidelines also instruct that when initial inguinal hernia repairs are performed on preterm infants who have a post-conception age of 50 weeks, but are younger than 6 months old at the time of the procedure, coders should be reported using one of the following codes. 49495, repair, initial inguinal hernia, full-term infant younger than 6 months, or preterm infant older than 50 weeks post-conception age and younger than 6 months at the time of surgery, with or without hydrocelectomy, reducible. 49496, incarcerated or strangulated. Safian urges coders to pay close attention to the details when assessing the patient's age. For example, if the patient who is undergoing this procedure is 6 months and 1 day old, the coder would have to report 49500, repair initial inguinal hernia, age 6 months to younger than 5 years, with or without hydrocelectomy, reducible, or 49501, incarcerated or strangulated, she says. AMA parenthetical guidelines state the coders should not report modifier -63 with either Captain codes 49495 or 49496. AMA parenthetical guidelines also state that for section 49491-49659 hernioplasty, herniorrhaphy, herniotomy, coders need to report the excision or repair of strangulated organs, such as testicles, intestine, or ovaries, with an appropriate code from the excision repair section, e.g., 44120, 54520, 58940, along with the code for repair of the hernia. Femoral hernia repair 49550-49557. Femoral hernias occur below the inguinal ligament, where abdominal contents pass through the femoral canal. For femoral hernia repair, the surgeon makes an incision in the thigh below the inguinal ligament over the femoral canal. He or she splits the subcutaneous fat, exposing the extraperitoneal fat enveloping the hernia sac. The mass of peritoneal fat is freed by blunt dissection. The inguinal ligament, overlying fascia, and neck of the hernia are exposed. The fat mass is split and the sac is also exposed, then dissected up to and beyond the neck, and opened so the contents can be inspected. The bowel and omentum are returned to the abdominal cavity. The sac is ligated at the neck and transected. The stump is returned to the abdominal cavity and the inguinal ligament is sutured to Cooper's ligament. A mesh plug may be applied before closing the site in layers. CPT coding and documentation. Coders would use one of the following codes to report a femoral hernia repair. 49550, repair initial femoral hernia, any age, reducible. 49553, incarcerated or strangulated. 49555, repair recurrent femoral hernia, reducible. 49557, incarcerated or strangulated. As these codes reside in Captain Code Range 49491-49659, hernioplasty, herniorrhaphy, herniotomy, the manual instructs coders to report excision or repair of strangulated organs along with a separate code for repair of the hernia. Abdominal hernia repair 49591, 49596, 49613, 49618. Abdominal hernias, otherwise known as ventral hernias, occur when intestines bulge through a weakness in the abdominal wall. Surgeons can perform abdominal hernia repair by open, laparoscopic, or robotic approach. In each procedure, the surgeon gains entrance to the abdominal cavity, either by open incision or keyhole incisions, extricates the hernia from its surroundings, and examines it for defects. In some instances, physicians may need to remove necrotic tissue before settling it back into place. Once the intestines have been replaced behind the abdominal wall, the provider can insert a mesh or prosthetic barrier beneath the dermal and muscle layers. He or she then closes the site and applies sterile dressings. CPT coding and documentation. The AMA redesigned the codes that are used to report abdominal hernia repair in its 2023 CPT code update. In this update, the AMA shifted emphasis from the type of abdominal hernia being repaired and type of surgical approach to the length of defect and presented complication. Examples of codes that represent this change are as follows. 49591, repair of anterior abdominal hernias, i.e., epigastric, incisional, ventral, umbilical, Spiegelian, any approach, i.e., open, laparoscopic, robotic, initial, including implantation of mesh or other prosthesis when performed, total length of defects, less than 3 cm, reducible. 49613, recurrent, including implantation of mesh or other prosthesis when performed, total length of defects, less than 3 cm, reducible. Coders should pay close attention to the guidelines associated with Captain Codes 49591-49618. With the 2023 Captain overhaul of this section, it is imperative new and seasoned coders alike pay close attention to the guidelines within this section of Captain. I always recommend when selecting a code, coders scan up and down the page, and in this case, the pages before and after, of their selected code to review all the parenthetical notations Captain provides us, says Jacob Swartzwelder, CPC, CRC, CIC, CEMC, AAPC approved instructor, SAFE 5 practitioner, who is the managing director at Compliant Approach Partners, LLC. Parenthetical guidance also directs coders to not use modifier -50 bilateral procedure, with codes from range 49591, 49622 hernioplasty, herniorrhaphy, herniotomy procedures. For debridement of the abdominal wall, coders can use one of the following codes. 11042, debridement, subcutaneous tissue, includes epidermis and dermis, if performed first 20 square centimeters or less. 11043, first 20 square centimeters or less. For reduction and repair of intra-abdominal hernia, coders are directed by parenthetical guidance to use Code 44050, reduction of volvulus, intussusception, internal hernia, by laparotomy. Peristomal hernia repair 49621, 49622. Peristomal hernias form when a section of the intestine herniates around a patient's intestinal stoma. They are a frequent late complication following colostomy, according to a Frontiers in Surgery case report. CPT coding and documentation. CPT codes used to report peristomal hernia repair are as follows. 49621, repair of peristomal hernia, any approach, i.e., open, laparoscopic, robotic, initial or recurrent, including implantation of mesh or other prosthesis, when performed, reducible. 49622, incarcerated or strangulated. Implant removal. Providers may have to perform surgery to remove part or all of the mesh or prosthesis, as when the patient's body rejects the implant. For cases in which the mesh or implant is not infected, coders would report the procedure with add-on code 49623, removal of total or near-total non-infected mesh or other prosthesis at the time of initial or recurrent anterior abdominal hernia repair or peristomal hernia repair, any approach, i.e., open, laparoscopic, robotic. Parenthetical guidance directs coders to use code 49623 in conjunction with a code from range 49591-49622. For removal of infected mesh, use add-on code 11008, removal of prosthetic material or mesh, abdominal wall for infection, e.g., for chronic or recurrent mesh infection or necrotizing soft tissue infection.